We've had a long, hot summer. We've had a lot of screaming and debating, but there's some real myths about healthcare reform as it stands right now. The first myth is that healthcare reform will ration healthcare. Let me tell you, in 29 years, what I see is rationing healthcare are the insurance companies. I can do absolutely nothing for my patient without knowing what type of insurance company coverage you have. That is the end of every conversation, because it dictates what prescription I can write, it dictates what hospital I can send you to, it dictates what type of test I can do. So if we're having rationing of healthcare, it exists right now. Healthcare reform will open that up. It will take the bureaucrats, the insurance bureaucrats, out of the relationship between the patient and the physician. That should be a sacred relationship. It is no longer such in the United States of America. The next myth. The next myth is that healthcare reform will cut Medicare benefits. Let me tell you something. Everyone was real excited about Medicare Advantage and Medicare Part D a few years ago. Ask your Medicare patients now how excited they are. Their costs have gone up. They have less access to medications, and it is just not working. When you look at the analysis of costs with Medicare Advantage versus regular Medicare, the cost is about 20% higher for our government. What healthcare reform will do will, number one, open up the advantage of discount medications for Medicare patients. When I write a prescription for a Medicare patient and they can get a discount on a brand name medication, they cannot use it under the Medicare Part D plan. Under Medicare A and B or C, they cannot use it. So with Medicare Part D, what we're looking at is opening up discounted products for our patients. Medicare Part D is costing us too much, but at the same time, we can improve the benefits with our patients. So that is another myth. So all the Medicare patients in the audience this evening, if you study your plan, you will find out that your costs have gone up and that you have less access to some of the better drug products that we have available. The next myth, healthcare reform will promote euthanasia. In other words, a death penalty. That is laughable. That is very laughable. And the reason it's laughable is because we need to begin to make those decisions for ourselves. The bill actually encouraged that dialogue, to dialogue about those things that are important to you as you approach the end of your life. So we want to debunk that myth for once and for all. There is no euthanasia in the United States of America. You can have a living will and you can decide how you want your terminal days to look. The other myth, healthcare reform will bankrupt America. Well, I say Americans are being bankrupt. Individual Americans are facing bankruptcy every day because of unfortunate illnesses, things that they have no control over. As Andrea mentioned, those who have health insurance oftentimes find that their benefits are capped. They find that they have out-of-pocket expenses that they never knew about. And you know something? Most people believe they have good health insurance until they start using it. When you start using it, you find out what your copays are, you find out what your deductibles are, you find out what your limits are. Our health care right now is bankrupt in America. We have large corporations that are leaving the United States of America to avoid providing health care for their employees. It costs too much. And as the costs have increased, the bottom line for the major insurance companies has also increased. We get less a day to make up for the costs that the insurance companies are not covering. So I love all of you all being out here this evening. This is such an important message that we need to get out. We've had all the screaming and all the hollering in August. It is time for sensible discussion. It is time that our legislators and our senators know that we will not take anything less than a reasonable health care that covers all Americans. Thank you.
Thank you, Dr. Joseph. Thank you. Thank you very, very much. All right, I see some more people have arrived. Fantastic. All right, now I have another MCV doctor here. I'd like to call on Dr. Susan Miller, please. So, Dr. Susan, take...
50 must have been a good year because I've been in family medicine for 29 years too. And I've worked in 3 different locations. I spent my first 3 years in a community health center, so I understand people who don't have any insurance and are looking at the safety net to bail them out. I spent the next 20 years right down the road in Midlothian in a nice middle-class suburb where I took care of people who mostly had health insurance through their employers, and guess what? They were only one pink slip away from bankruptcy. And in the last 4 years, because I bailed out of private practice for all those reasons that Dr. Joseph told you about, the frazzle, the gray hair, the fact that my overhead just went up and up and up, the fact that there's nobody coming behind who's training in primary care. When I retire, there's not going to be anybody. We've been down, down, down with primary care recruitment, and it's because of this administrative complexity and the frustration that doctors have trying to take care of patients when we don't have an MBA. So I bailed out of private practice and I joined an institution down the road here in academics, and I'm working there to try and save primary care and try and get health care for everybody in this country. So I'm the one who brought this because I'm the state contact for Virginia Physicians for a National Health Program. There's 16,000